Hi, my name is Caitlin Boyer, and this is the discussion 4.1 for Gautam Patel. Mr. Patel is a 25-year-old male who presents to see the psychiatric nurse practitioner for treatment in his severe anxiety. He was diagnosed with anxiety when he was 15 years old. He is now in college and is having trouble attending some of his classes because of his anxiety. His mother is with him and says that he is what she calls depressed. And he's been participating in cognitive behavioral therapy for about 6 months with little help. And he needs more help, which is why he's here today. Cognitive behavioral therapy is a therapy that's based on the belief that your mental health is dependent on how you react and adapt to situations in your environment. The therapy involves many techniques that are used to help the patient kind of navigate their thought process in a positive way versus a negative way. One of the hallmarks of cognitive behavioral therapy is Socratic dialogue, which is where the therapist and the patient, while they're conversating and talking, they kind of work through their thought process, the patient's thought process, mutually for like the first time, and the therapist kind of guides them through that so that they kind of work through their thought process. And in doing that, the therapist can kind of narrow down what techniques might work the best for how they think and what their situation is. Cognitive behavioral therapy can be used for many different disorders, not only psychological, but also medical, including tinnitus, chronic pain, PMDD, chronic insomnia, chronic fatigue, depression, anxiety, eating disorders, and also in social situations like marriage and couple problems and substance use. I think with Mr. Patel, decatastrophizing technique might work for him depending on, how the initial dialogue would play out with the patient. If he were to say something like, I don't go to class because I'm afraid of a school shooting or something traumatic happening, or if he had any traumatic events in the past, we could maybe talk through the decatastrophizing technique together. Catastrophic thinking is one of the hallmarks of anxiety, according to the Wheeler textbook. And decatastrophizing technique allows for balance and more realistic focusing by examining the worst possible outcome. There is a possibility for catastrophic events to happen in any situation, but realistically, they would probably not happen. So the therapist and the patient talk through their thought process on that event. For example, the school shooting, you could talk through them of, the percentage of the school shootings and how you might go about protecting yourself but still getting out and attending class, and talk them down from that catastrophic thought process. Catastrophizing is when an individual overestimates a severe negative outcome, like we talked about. And so you would talk to the patient and find out really what their big fear is in the worst possible scenario, and then redirect them to a less negative or a positive outcome. Like, that is the worst possible scenario, but a positive scenario that could happen is you could make friends or learn something, or, so that's one that I think would work with him and his anxiety.